All right, so we're going to go over the emergency medications at this time. These are medications that a student would have in school because they have a serious health issue. It could be asthma, which would be an inhaler. It could be severe allergies that would warrant an EpiPen. It could be diabetes, which would be glucagon, or it could be seizures, which would be one of two medications that we're going to go over. The first medication that we're going to talk about is an inhaler. At this level, most of our kids carry themselves. They have to have paperwork on file. There has to be paperwork signed, a permission form signed by the parent and the doctor. And once they have that, they can carry their inhaler. They should have it in a box, and the box should have a label on it that has their name. It'll also say what the medication is and how often they can take it. Inhalers are typically taken by a parameter. So what that means is the doctor will say they could have 2 to 4 puffs every 4 to 6 hours, or 1 to 2 puffs, whatever it might be. The student will know that, but it should be on their paperwork. It should be on the box that hopefully they have. So if you have a student that you're responsible for their inhaler, these are the things that you would need to do. If they come to you and say, I need to take my inhaler, you just hand it to them, but watch it. Watch what they do. What they should do, each depression of this canister is 1 puff. So they should shake it up really well, remove the mouthpiece, tilt their head back. I'm not really going to take this, but shake it up, tilt their head back, exhale, put this in their mouth, depress 1 puff, hold their breath for about 5 to 10 seconds. And then they should wait 1 minute in between puffs. If they're having a hard time breathing and you're concerned about them, I would ask them, are you having a hard time breathing? And they'll tell you, yeah, it's worse than normal. If you need to, call that parent or call 911, because people can and do die from asthma attacks. So don't play around with it. If they're having a hard time breathing, they should wait 1 minute in between puffs. But if they're struggling, see if you need to call 911. There is a chamber, looks like this. They could look a little different. It's typically used for smaller children, elementary school kids. We may see it once in a while here at the high school, but the function of the chamber is it just goes with the inhaler. The inhaler just pushes into one side. You can't do it wrong. It's only going to go one way. They put this part in their mouth, and everything's the same. Tilt their head back a little bit, let them breathe out, depress the canister, and they will breathe in. The medication concentrates in here in the chamber. And it just makes it a little easier for a small child or a student that's maybe high school level, but maybe they don't do this too often. It's a good thing for them. The next medication we're going to talk about is glucagon. Glucagon is a hormone. It's made by the body, and it just tells the body to make sugar. That's all it does. We have a large number of type 1 diabetics here at Conner High School. Most of the parents supply this glucagon. We have a few that don't, and that's up to them. This is what a real glucagon looks like. It comes in this kind of reddish container. You have a syringe. The syringe has 1 cc of a sterile water, and you have a vial. And I don't know if you can see that in there, but in the vial is a powder. And you have to mix the two in order to have a shot for glucagon. So let's say that you have a student. We're going to use, this is our trainer. But let's say you have a student that's diabetic, and you know that. You go on a field trip, and you have sent me a list long before your field trip of all the kids that are going on that field trip. I have to check each student and see what their medical issues are. So let's say you have a diabetic. We know that. I told you you have to take the glucagon. So you're on your field trip, and you're on the bus, and the student is just kind of sitting on the bus and kind of just leaning to the side. You go over and shake them. If they answer you, ask them, do you feel okay? Because sometimes their blood sugar starts to go down and they don't know it. So most of the time they feel it and they correct it by eating something or drinking juice, something like that. But once in a while, maybe they're tired, they fall asleep, they don't realize their blood sugar is dropping. So if you shake them and they say, oh, yeah, I'm okay, let me check my blood sugar, and they check and it's low, then they can eat or drink something to bring that blood sugar up. But if you shake them and they either don't come around, they're unconscious, or they're not making sense when you do wake them up, you're going to need to give the glucagon. In diabetes, you always treat the diabetes first. It could be something totally unrelated, but you don't know that. If you treat the diabetes first and you're wrong, you're not going to hurt them. This is just a hormone. You're not going to hurt them. If you overdose them, you can't overdose them, underdose them. It doesn't matter. So what you do, let's say our child, for our sake, is unconscious. So we get them out of their seat, lay them on their side on the floor, get something under their head, because when their blood sugar drops, they can have seizures. So we want to get this glucagon in them as fast as we can. It's something that's rarely given, but it does happen. So you would take the end off of the syringe, put the syringe into the vial, inject the 1 cc of sterile water, gently swirl it, don't shake it, just gently swirl it, turn it upside down, and take that 1 cc right back out. You don't need to worry about air bubbles. You don't need to worry about wiping their skin off with alcohol. None of that matters. It takes about 50 cc's of an air bubble injected directly into a vein to do any harm at all. This entire syringe is about 3 cc's, and you're just putting it into the fatty part of their arm. So you hold it like a dart, because on the real thing, this piston moves very easily. So you're going to be nervous, so you don't want to inject this into the air. So keep your thumb away from that piston until you're ready to push it down. Hold it like a dart. Get their arm. If their arm's what you can get to their arm. It goes in, push it down, done. Have somebody call 911 as soon as you know you're going to give this. So this will travel with the student when 911 gets there. So what you should do is put it all back in. If you can, if you have a Sharpie, write the time on it. But otherwise, just hand it to them and say, I gave this at 11:54. And they should take it with them. If you have to wait for 911, sometimes a student will start vomiting. It's because their blood sugar is being elevated so quickly by this glucagon. It doesn't matter. Keep them on their side. Just don't let them get up and walk around. If you're wrong, it wasn't their diabetes, they're going to throw up. If you are right and it was their diabetes, they're going to throw up. So it doesn't matter. You can't hurt them. The next medication we're going to talk about is epinephrine, or an EpiPen. It comes in a 2-pack typically. This is what the box looks like. It has 0.3 milligrams of epinephrine in it. It comes with 2 EpiPens. However, most of the time, a parent will leave one at home and send one to school. So most of the time, I only have one. A lot of times, too, at this level, kids will carry one and you'll have one. But let's say you have a kid with a bee sting allergy. You're on a school bus going to the zoo, and a bee gets in the bus and stings that very kid that has the bee sting allergy. And you know that because you've sent me a list long before your field trip, and you've told me all the kids that are going, and we've checked it, and you have taken the EpiPen because I've told you that kid has an allergy. So you have your EpiPen, he gets stung, you go over, pull the blue end off. There will be a hole in the blue end. You cannot cover that hole. Most people want to hold it like that. If you occlude that hole, the medication will not dispense. The medication comes out of the orange end, so you want to keep your hands clear of that. So you hold it tightly, and in a swinging motion, get it into their thigh. It doesn't matter left or right thigh. You hold it in place for 10 seconds. The medication will dispense in that 10 seconds. When you're done, you hold it up. The orange sheath comes down, covers the exposed needle. You tell somebody to call 911, and when 911 gets there, you hand this to them and say, I gave it at whatever time you gave it. The one thing that you need to be aware of, it is sheer adrenaline. So when you give it, within about 2 minutes or so, that student's going to start shaking, their heart is going to pound out of their chest. It all just means this is working. It's only going to last 10 to 15 minutes. That shaking will go away pretty quickly. Just stay with them and reassure them that it's okay. It just means the medicine's working. The next thing we're going to talk about is Diastat. Diastat is given for students that have seizures. We have a lot of students that are listed as having seizures, but if the parent doesn't supply any medication, or it's the first seizure they've ever had, they're going to be an automatic 911 call without question. But if they have medication here, we have two different seizure medications. One is a rectal medication, that's Diastat, and one goes in the mouth, that's clonazepam. We're going to talk about Diastat first. The doctor will order this medication, and he will tell the pharmacist however much he wants the student to have. So there's a number on the side, and that's the milligrams of the Valium, which is all this is, that he wants the student to have. The pharmacist will dial it in. They will then activate this green band, and there it is. You can't change it. You can't overdose them or underdose them. It comes in a pack just like this. It's very hard to open. This isn't so hard to open because I've opened and closed it so many times for training. It opens very easily. But on the inside, I will give you a piece of paper that is step-by-step instructions on this Diastat. You will also have a small packet of KY jelly, and I always tape it to the front because when you open it, it's one of those things that's going to fly out. I'll also put a couple pair of gloves in here. But the Diastat sits neatly down in there. It's pretty snug down in there. So what you would do is you would take your gloves out, and we're going to pretend I have gloves on. You've got a child that's having a seizure, you get them down on their side, doesn't matter left side or right side, get something under their head, a backpack, a jacket, anything that you can get, and start timing the seizure. So if it starts at 10:15, you're going to make a note of that. All right, it's 10:15. All you can do is keep them safe. Get the other kids out of the room, give them as much privacy and dignity as you can, and just keep them safe. So let's say it started at 10:15 and now you're at 10:18 and the seizure's still going on. So 10:19, you're probably going to have to give this. I would be getting ready by 4 minutes in. So we have our gloves on. You pick your Diastat up out of the pack, flip this lid off, take that packet of KY jelly, open it up, and I would just set it on top of it and just wait. So by 4 minutes and 45 seconds, you pretty well know you're going to have to give it. You could get that student's pants down, but wait, don't give this until 5 minutes if that's what the doctor has ordered. Sometimes they order it to be given immediately, and sometimes they tell you to wait 5 minutes. But I will let you know that. It'll be on their paperwork. So if it's at 5 minutes, you tell somebody, call 911. This goes in rectally, just goes in. You depress the plunger, 1, 2, 3. You wait, 1, 2, 3. Take it out and hold their little butt cheeks together, 1, 2, 3. That prevents any leakage that may come out. And then you just wait with them until 911 gets there. Hopefully, the reason some of the doctors say wait 5 minutes is because usually seizures will stop in that amount of time. But if they're still lasting 5 minutes, we need to stop them. The next medication is called clonazepam. And it is a pill. So it will come in. Usually what I do is I take a little plastic bag, I put a pair of gloves, I put a couple of these little 2x2s in. There will be a paper in here, and then you'll have a prescription bottle. Clonazepam, it's called clonazepam ODT, which means orally disintegrating tablet. The tablet is very fragile. So it'll come in the bottle, the prescription label will be on here, but inside the bottle will be a little peel pack. So usually the rules are the same. The doctor will say either give it immediately or wait 5 minutes. So let's say we're waiting 5 minutes and we've got the student down on their side, the room is cleared, you started timing it as soon as it started happening. Put your gloves on and just wait. So when you get to about 4 minutes of that seizure, you're going to have to peel this back and it'll reveal the pill that will be sitting down in this little well. When you look at the pill, it's so fragile, it is either going to be sitting down there whole, or it'll be broken in 2 or 3 pieces, or it'll be complete dust. It doesn't matter what it looks like, you can still use it. I would just leave it in the peel pack. Don't try and take it out if it's broken at all. So let's say I have my gloves on, students down on their side, and we're almost at 5 minutes, and I know I'm going to have to give this. I've opened it, and I see the pill sitting down in there. So now it's time to give it. So you're going to take one of these 2x2s and extend the bottom lip and dump this in like this. Let it go. Rub the outside of the chin. You just want to dissolve this as quickly as possible, although they do dissolve quickly, and that's one reason you want to wear gloves, because you'll be nervous, your hands will be sweaty, and just natural oils on your hands. You don't want to pick this pill up and it'll start dissolving in your hand, and you will absorb that medication. It's a 911 call automatically as soon as you know you're going to have to give it. Just keep the child safe. That's all you can do.